Hi, it's Mark. I'm at the ADAP Advocacy Association's annual conference. And do you know that it's more than just ADAP here, which is the crisis, of course. But did you know, for instance, that there is a national governmental program that'll provide you health insurance if you've been uninsured for 6 months and have a pre-existing condition? Did you know that there's a foundation whose mission it is to help resolve conflict between you and your insurance company if they're not paying for a treatment or a med or something like that, and that their success rate is 91%. I have learned so much here at this conference. There's a lot to learn. So come along.
We all have the same condition. It's called life. I'm living mine as a gay man and an addict in recovery who's dealing with aging and being a friend and finding happiness and staying healthy and having fun and enjoying laughter, all while living with HIV for more than 25 years. I'm Mark S. King, and this is my fabulous disease. The ADAP Advocacy Association Conference began with some sobering facts by our host, Board Member Joey Wynn of Fort Lauderdale.
Here we are again, a year later. We started last year probably around 900 people on the wait list. We now are sitting here close to 9,000 people without regular access to life-saving medication.
Unfortunately, these are the times we're in, and because the economy is still so slow and so many people are trying to access the program, that's one of the biggest drivers behind this.
Our first speaker delivered a thrilling call to action against HIV ignorance and stigma.
You see, I'm sick and tired of people burying people every other Sunday, and they're lying and saying that they didn't die from HIV or AIDS, but it was a case of cancer. Everybody ain't got cancer, y'all. So I want to know, where are you when we need you to stand up, speak up, and it's time for us to start acting up.
To hear Joyce talk about the anger and the fear, those are the two attitudes that are most reflected when you go out in the community and you talk to people living with HIV/AIDS who are, trying to access this program and are being told to wait. They're angry and they're fearful.
A speaker from the National Association of State and Territorial AIDS Directors, NASTAD, reported on ADAP progress, but when they mentioned how pharmaceuticals had lowered their prices for state ADAP programs, they couldn't say by how much, because it's private. Well, is it 5%? 80%? Does anybody know? Finally, a NASTAD representative said that the discounts began at 22% and were sometimes larger. Good information. Thanks for letting us know. A session on the eligibility requirements for ADAP exposed a dirty trick many states are trying to pull to shorten their waiting lists. They're changing the program criteria so it knocks people off the list who no longer qualify. This burns my butt.
It is not acceptable to consider lowering eligibility. Unacceptable. And so we will mount whatever we need to for political opposition to that, and they know that.
An excellent presentation on HIV patient treatment raised the murky issue of the role of ADAP in encouraging treatment, not simply providing medications.
People that are aware of their HIV status are less risky than people that are unaware of their status. And people that are undetectable are far less likely to infect someone else. So we talk about a community viral load. And if that community viral load is lower, there's less infection that occurs. And that's good on a number of levels, both for the person themselves and for the community they live in.
I was glad that the speaker covered the risks of HIV therapy. Going on medication must be an individual decision, and the role of ADAP is simply to provide medications to those who want it and can't get it. This program really got our attention. The Pre-Existing Condition Insurance Plan, PCIP, is a federal program meant to bridge the gap until our new healthcare system kicks in 2014. It provides health insurance, not free but reasonable, to those with pre-existing conditions like HIV who have been uninsured for 6 months or have been denied coverage. Here's their website and a phone number to apply. Here's my favorite resource for you, a workshop from the Patient Advocate Foundation. A lot of their services, which are offered to patients of any sort, involve resolving disputes when your insurance company won't pay for a medication or they won't pay for a procedure. And these folks have a 91% success rate. Here's their phone number and website. Oh, look, one of our speakers was Dr. David Satcher, former Surgeon General of the United States. Dr. Satcher was elegant and official, but generic in his remarks, and I don't remember a thing he said. Here's a great resource that political geeks are going to love. This presentation on social marketing introduced us to mygov365.com. This website allows you to track a particular elected official and see what they're up to, what bills they are sponsoring, how they are voting, so you can call them up and give them your opinion. You can also follow any particular bill and track its progress. It's like Facebook for Congress. They cover everything federal and what's going on the state level in 30 states so far. Next, a political consultant explained the importance of lobbying, and he had some advice for us.
If you are HIV positive and you have an opportunity to meet with an elected official, take it. And think of a couple of things that they've done that could to thank them for, and also think of things that you could mention to them that it would be most helpful if they would consider. Because you know if you don't, your opposition's going to be there.
Doesn't everybody look great? It must be time for the awards banquet. I asked a few of my friends what they've enjoyed so far.
So we had this speaker. She started the conference. Her main theme was, "Where you at?" And she was talking about the entire AIDS coalition, all different organizations, activists, advocates, saying we're not making enough noise, and that really that captured my attention, and I'm ready to make a lot of noise.
But it was the interaction in between the segments and the talks that I thought were really important. And it's really about the camaraderie.
The one thing that I was really impressed with were the women from South Carolina, the struggles that they're having, so many people that are on the waiting list, but yet these women are determined that they're going to get their message out, and that really, really touched me.
Coming to Washington to the AAA Plus conference makes me feel like Mr. Smith goes to Washington, naive yet hopeful that things will change.
And here come the honorees. I'll let Brandon explain why the awards are important.
What we thought it was important to do was take a step back and reflect and recognize that there have been people who have demonstrated tireless commitment, leadership to this issue, and to recognize that commitment and that leadership. And that's why we held the awards dinner. I think a lot of people were inspired, left that room kind of feeling refreshed that this is exactly why we're in this fight.
Oh my gosh, well, would you look at that?
The joy is in doing the right thing. The joy is in us.
And how many politicians tell the truth in public these days? Here's one.
Y'all, we got a crazy ass governor in this state.
And finally, look closely at these faces. These are the faces of people advocating for ADAP, fighting for funding, and urging their elected officials to do the right thing. Make no mistake, there is friendship and joy in this struggle. Now, some final words of wisdom from ADAP advocate Joey Wynn.
The magic about your blog is for people that are not healthcare advocates, people that are everyday people, they can get a little dose of it and get a picture and the gist of what an issue is. And you put it in such regular, everyday terms. It's like a Walter Cronkite, this is how it is.
Edward R. Murrow. I prefer Edward R. Murrow.
And now you're really dating yourself.
Yeah, I know. Oh my God.
Google it.